Hi, my name is Lanisha Yolden and today is the 21st of November 2018. And additional to my previous video, I just wanted to go over a few points with you in terms of dental procedure setup. So first I wanted to mention the periodontal probe, simply its use and function. So the reason we use the periodontal probe is to check the millimeters in depth of the periodontal sulcus. Just by holding parallel to the tooth on each of them, just to measure that depth. Now, as you can't quite see on the video, but it does have little indicators of the depth of millimeters there. So for example, a dog is to be less than 3 millimeters in depth and a cat 0.5 millimeters in depth. Simply if it exceeds that recommended depth in millimeters, then that tooth needs to be extracted. Now I also wanted to mention about the Explorer. So the Explorer is simply to look for caries and enamel defects on the tooth. So I'll demonstrate again for you. You just want to hold the instrument always like a pen, just going over each of those teeth there, just feeling for those enamel defects and taking note, of course, if you ever feel any for the vet to have a look for you. Now also I wanted to mention about the scaler and the curette. So the sharp tip one is actually the scaler. So that is only to be used super gingerly, simply as if it were to go above the gum line, which is subgingivally. It will create some gingival tears and damage there, which obviously we don't want. And then the other side you've got the curette, which is a bit more of a blunter tip, which is to be used subgingivally, so above the gum line, as that's not going to create any damage to the gingiva. Now the reason we do this is to remove any dental deposits, and also it's really important too, when you are doing it and you're pulling down, you're always finishing on a downstroke, so you're never going upwards, always on a downstroke. I also wanted to mention sharpening as well, additional to my previous video's technique. I did want to mention with the block here that it's really important to put some IM3 oil on there. So by doing that, you just put a couple of drops onto the stone there, and then that's when you can sharpen your instruments. Really important too, for example, additional to my previous video, when you are finishing your sharpen, you always want to finish on a downstroke as opposed to an upstroke. Additional as well, I just wanted to mention that it's really important that you wipe over a towel as opposed to your finger, just to remove any of those sharp edges or any dust particles there. I'm just making sure, just for work health and safety reasons. Really important too, so when you sharpen instruments, it's simply before patient use, after they've been autoclaved. So that's what I'll talk to you now about, is the cleaning of each of these instruments. So after a dental procedure, obviously it's quite a dirty procedure, we like to wash all of our instruments in a enzymatic cleaner. So what we use is Medizyme here. And now after those have been washed, I like to add as well, that's to be done in warm water, just so none of that lukewarm water, just so none of those fats or bloods get set, just like you would a surgical instrument. Now after those have been highly disinfected, washed with that Medizyme, it's there to be sterilised. So you can, and as well with the attachments as well. So for example, our scaling machine, it can actually, here we go. The attachment can actually be removed, and by doing that on our scaler machine is with this tool here. So you just pop it in there and twist. Alrighty. And then you've got the scaling tip, which is separated. Now that is to be sterilised, so obviously washing first. That can just go into a sterile sterilising pouch there and to be sterilised on its own. Another few things that we like to sterilise is obviously all your instruments. We do have this container here, it's from IM3. This can be sterilised. You don't want to overpack it, so you obviously don't want to stack your instruments on top of each other. They've got some racks in there which you want to place nicely. So any additional instruments, for example, our extracting forceps that aren't going to fit in there, just popping those in your sterilising pouches as well, to be sterilised just like that. Also as well, with this IM3 container, once you close it, you can actually sterilise this as well. But I like to put it in a pouch just for that extra sterility. So just using one of your large pouches for that. Alrighty. Remembering as well, just making sure that you sharpen those prior to use before every patient as well. Now, what I also wanted to mention is so cleaning of the dental machine itself. So obviously we can't sterilise the whole machine, especially because it is most of it is plastic. So I'll talk about that. So what you want to do first is turn off all of your parts. So by doing that, you just want to, I'll bring it to you. You can't really see, but you've just got some off buttons on the side and the back. So of your scaler end of your IM3 machine. Also, you want to turn it off at the wall because the scaler does plug in. So just removing that one. Now, in terms of cleaning, we like to use a high-grade disinfectant. So we use F10. So just some F10 and some paper towel. I like to spray straight directly onto the towel first. So for example, just grabbing all of your cords here, starting from the top and working your way down with that F10. Same for all of your instruments and all of your cords and attachments, as not all of them can be pulled off and sterilised. Only the scaling tip in this case, and the drill pieces as well. There we go. Now in terms of storage of this machine, so we take off all your attachments, so your cords, for example, your power cord like this one, and simply just rolling it up, and then we have a particular storage drawer for all of these cords, simply so they're not getting laying on the ground or anything like that or falling off the top. So we do all of that, roll everything up, including the pedal for our scaling machine, same again, and then we just store that one away. There we go. And then for the rest of it here, so for your foot pedal as well, which just to mention as well, this is really important that you do clean as well. Alrighty, so just I like to roll this one up and just placing it at the back of the IM3 here. Now, in terms of actual storage, you want to make sure obviously it's inside, out of any weather, out of away from your actual wet table where it's going to get contaminated over and over prior to when you actually need to use it. So we like to store it in a cupboard with our compressor and all of that. And we've actually got a cover for it as well, which I don't have here with me today, but I'll demonstrate it into my my assessment for you. What I also wanted to mention as well is additional PPE. So additional to my previous video, your gloves and your mask and all of that. So I always recommend using a gown as well, simply from all those bacterial particles and aerosols. So here we do use a disposable gown. In the circumstance that you're unable to use disposable and you've only got your linen, it's always to be washed in the washing machine and then sterilised in your single pouches prior to use for the next patient. Same with your hair caps as well. Like I said, those particles and aerosols can travel quite a distance. It can travel up to 7 meters. So I always like to wear a hairnet as well. Now we don't have disposable hairnets. We've only got our normal caps. So like I said, with linen, you need to wash those in the washing machine and then sterilise them in their single pouches prior to your next patient use. Now with obviously our masks and our gloves are disposable. In the circumstance that obviously you've got your goggles that are not disposable, I always recommend your F10 solution just for cleaning those, a high grade disinfection. Alrighty, awesome. And it's really important too, once you've actually wiped away those contaminants, just having that 10-minute contact time is recommended. Also, I'll pop in my assessment the link of my sharpening technique video. Thank you.